everybody. Today we're talking about younger looking eyes. A little bit late here, but okay, I'm gonna get a head start. Let me shut this door. Hold on, stay right there. Okay. Hi everybody, so sorry. I'm sure that's not great to come onto a live and like, the host isn't even there. I'm gathering stuff, you guys. Hi, it's younger looking eyes. I have no makeup on, I'm a little disoriented, but to get my shit together. Okay, hi everybody. Oh, hi from Amsterdam, from Paris, Amsterdam, you guys. My daughter's wedding was exhausting and spectacular. Yeah, I can't believe I have a kid that's married. She's 28. And it's my son's birthday today. Hi, Germany. Good evening, good evening. Yeah, it's my son's birthday. He turned 26 today at 6:23 p.m. is when he was exterior of my body. I don't know how to say that. When I birthed him, that was the time. Hi, everybody. Okay, I gotta like bring my cortisol levels down. I'll tell you why I'm a little bit late, and then we're gonna get into it with the eyes. By the way, I just have a little bit of mascara on, you guys. That's it, little bit of lip stuff, and that's it. I was gonna do like a tinted sunscreen, because we're just talking about the eyes, but I can't find my red light therapy mask. My Omnilux red light therapy mask, and I just had it a couple days ago. I was showing it to a client. I used it a day before yesterday. So I don't know if one of my girls came in and like, you know when your daughters will come in and borrow like your clothes? Mine come in and borrow like skincare gadgets. So the two devices, this two red light therapy masks that I have in my possession are the Omnilux, which is the best, and then the Current Body, and both of them are gone. So I have yet to look in my daughter's room, who's still sleeping, but I would imagine that's where they are. Okay, we're gonna get into it. This show is about younger looking eyes. Let me close this door, trying to not be distracted here. Okay. I hope you guys are good. Okay, you guys, when we're talking about eyes and the delicate skin around the eyes, it's not a one size fits all kind of protocol, okay? I am making a younger looking eyes protocol that will give you guys, different treatments for different concerns, but we need to talk about the different concerns because this is not the time to borrow your friend's, eye cream. Your friend might not have the same kind of issues or concerns that you do. So I wanna go over all of that stuff. So just like your skincare routine, your upper eyelids and your lower eyelids should be completely tailored to your skin concerns. Okay, so here are my top eyelid treatments. When I say eyelid, I'm talking upper eyes and lower eyes. And I know I'm gonna get this question, so I'm just gonna address the elephant in the room because it's gonna come up here pretty soon. No, I have not had surgery on my eyes. I have not had a lower bleph. I have not had an upper bleph. So I do not, somebody says, do you suggest fat transfer for the eyes? No, it just depends because when we age, you lose fat here. We lose fat in our temples, we lose fat in our cheeks, and you'll lose fat in your tear troughs, okay? Anything that you think you lose fat down here, that is a sagging of that, right? It's not that you need filler here. It's you're losing a volume up here, temples up here, and a little bit in the tear trough. We're gonna get to that. Because I always think, make sure you're addressing the right concerns before you just turn to plastic surgery. Somebody said, I really like your personality. That's like, honestly, best compliment. Thank you so much. Okay, so when we're talking about, let's just address the different concerns. So we have fine lines and wrinkles. Some of us have this trifecta of all of them. Fine lines and wrinkles, eye bags, discoloration. You know, who's got the trifecta of like all of the issues that age this delicate skin, right? You could have an eye bag, you could have wrinkles everywhere, fine lines and wrinkles, you could have the crepey eyelid skin, and you could have discoloration. And those types of treatments change depending on what your particular concerns are, okay? So I'm gonna address the first one, which is fine lines and wrinkles. Stay with me, you guys, because if you've got skin discoloration, trust me, it's coming up, okay? So fine lines and wrinkles. So if that's your main concern, there's a lot of different gadgets that we can do, and we're gonna get into the creams as well. So if you're looking for a cream, an eye cream, I'm gonna get to the whole dark circles. There are some genetic components, but if you're looking for an eye cream for fine lines and wrinkles, you wanna look for a cream. Now, I'm not an ambassador for any of these, but you wanna look for a cream that has retinol in it. I'm just showing you guys the ingredients you want to look for, because everybody has a different socioeconomic status, and not only that, but has a different commitment to skincare, right? You might have a big commitment to buying designer bags. My commitment is to skincare. So everybody has their own free will of what they choose, how they choose to address how your skin is aging. Again, it's not a one size fits all. But if you have fine lines and wrinkles, you are gonna wanna look for something that has a retinol. This is by Dr. Gross. This is triple correction eye serum, and it's advanced retinol. So if you have fine lines and wrinkles, this is what you want to look for, ingredients like that. Somebody just asked, what's the difference between using retinol and tretinoin? So tretinoin is like I want to say the unprocessed version of retinol, right? Then it goes through different types of strengths, and they change the molecular composition, so it becomes less and less irritating. So when you get an over-the-counter retinol, it's not the same as if you had a prescription strength. Shoot, I don't have a prescription strength here, but I can go grab one. Let me grab one for you guys. Hold on, you guys. Hold on. There's a lot of information coming up. Hold on. Okay. Okay, so if you're doing something from your dermatologist, you're looking at a prescription strength. This is a prescription strength Retinoid. This is tretinoin, okay? It's a 0.05%. I got this from Mexico. I think they tretinoin. I don't know how to say that. My accents are terrible. Okay, so this is a retinoid. It's a Retin-A. It's a tretinoin. It's a 0.05%. Now, if you put this on your eyes, on this skin, it's gonna eat it up like battery acid, okay? So if you're dealing with fine lines and wrinkles, a way that you can still use your prescription strength retinoid is that you can add a little bit of a barrier. So you could add like a nightly moisturizer. You would do your tretinoin around your face, avoid the eyes, put a moisturizer on it first. It gives a little bit of a barrier, and then you can add a little bit. I like to switch to a retinol, an over-the-counter non-prescription for around the eyes, because the skin is very different. Like, you wouldn't want to put this on your neck because the skin on your neck is very similar to the skin on your eyes, okay? But when we're dealing with fine lines and wrinkles and you're looking at skin care around the eyes, you want to look for a retinoid. Now, I'm going to save you guys a bunch of money right now. Because eye creams, yes, they're great, but are they necessary? Are they absolutely necessary if your concerns are fine lines and wrinkles? You could, like I said, skip the eye cream and just do a little bit of a barrier with a moisturizer and use your prescription strength. So it kind of dilutes it a little bit. But this is what I've been using around my eyes for a retinol. Now this is adapalene. This is Differin gel. I think this is less than $20, you guys, and it lasts a long time, and you can use it on your whole face. It is a third generation tretinoin, so it goes through different stages. Third generation tretinoin, and it's safe for pregnancy, safe for nursing, and very, very, very little irritability with your and reactions. So it's great for sensitive skin. So why couldn't you use this around your eyes and still have great results as a retinol? Guess what? You can, because this is what I've been doing. This is what I've been doing. When I use retinols on my face, and I have been recently doing this Defrin gel, just giving my skin a little break from the high intense stuff. I'll put this on my eyelids, close to my eyes, and I'm telling you, this is very miraculous. If I had to say between this around my eyes and some of the other creams around my eyes, which one's more effective, I'm digging this. So I've been doing this with a little bit. Now this is expensive. I'm gonna save you money here. This one's expensive, but this is worth it. No affiliation. This is by the Zeo Skin Health. This is the Growth Factor Eye Serum. And I kind of feel, I love it because it's got like this little, see that? The tip stays cool and you can just glide it on your whole eye. So I'll use this first and then I'll put this over. And my concerns are fine lines and wrinkles, okay? So when you're looking at devices, at home devices, and you have fine lines and wrinkles, there's a lot of different stuff that you can do. This is by MyoLift. This is the MyoLift QT. This is by 70 Wellness. And you can do microcurrent around the eyes, okay? So this is a microcurrent mask. Ooh, I wish I wouldn't have just put on that eye cream because I don't want to screw up the sticky stuff on that. So let me see if I can just kind of pat that down. But this is a mask, a microcurrent mask that you can apply, and that this connects with, whoops, see, it's not gonna work. Yeah, this connects with one of my devices here. So it literally, I'm gonna get it together, you guys. I'm gonna get it together. You put this inside here, and this can either connect to the MyoLift QT or the MyoLift Mini, which is my favorite microcurrent device. So fine lines and wrinkles, hooded eyes, crepey skin around the eyes. This is honestly my favorite device in terms of microcurrent around the eyes because it uses a 2-probe system, not a 2-lobe system. Did you ever try teardrop filler there? I'm gonna get to fillers and Botox around the area. I promise you, okay? But you can use this to separate the crow's feet. You can use it to lymphatically drain. I'm not gonna do the whole thing, but I'm just gonna show you guys, and I need a little bit of glide here. You can use this to stimulate the eye area, lymphatically drain, so this does work for puffiness as well. But fine lines and wrinkles and crepiness of the eyelid, you literally can push this. This is not attractive, you guys, but this is how you, this is the only way to demo it. You can push this up and it's creating that electrical charge between the 2 probes. It's not a 2-lobe system. This is a 2-lobe system, right? Like the new face. Hard to get this around the eyes. You're using a 2-probe system, much more control and much more effective around the eyelid. So if you're concerned, remember, your concerns are not your neighbor's concerns. Everybody has different skin. Everybody's at a different stage of aging. And so if your concerns are crepey eyelids, this is a great device. This is a great device, okay? So I'm gonna put that aside. And then, so microcurrent, there's also a lot of these kind of devices that use, can't get that to turn on. Let me see if I have my Venus somewhere close. Ooh, I just switched to a new vanity. And so my stuff is not very organized, but you can use something that heats up. Let's see if I can find it. Heats up the eyelid that will also help with the fine lines and wrinkles because it's collagen stimulating. Now you can't use radio frequency around the eye, but you can use some of these kind of devices that have a little bit of heat to them and also have a little bit of sonic vibration. So it can help your products soak in the eye a little bit better and kind of waken up that eye. Now this works for not only fine lines and wrinkles, but also eye bags. So if you've got an eye bag, you want to use one of these devices. It could be something like that. It could be like a roller and also like a dry brush to brush and get that fluid out to the side, okay? So we went over microcurrent. There's also microneedling, which you guys know I do that religiously. Let's see if I can get my device. Oh my gosh. This is a Dr. Penn M8. I use this religiously about every 6 weeks around my eyes. And for me, because my particular concerns are crepey eyelids and fine lines and wrinkles, I have found that nothing really works as good as the Dr. Penn when you're doing it consistently and you're staying on that occipital bone. You are triggering your body to produce collagen, right? So around the age mid-20s, we start decreasing our collagen by 1 to 3% per year. Depends on a lot of different things, lifestyle factors, stress, what else are you doing? Are you staying out of the sun? But when we start, that collagen kind of dips, you use a device like this that's creating microtraumas in the skin that trick your body into thinking, oh, I need to come to the rescue and build collagen and elastin. So the Dr. Penn for me has been great, the best treatment I have found that actually gets rid of all of the wrinkles. So at 55 years old and no makeup on, you guys, besides no mascara, but no makeup on, you can see what I'm dealing with here. Now, this is gonna get back to the question somebody had about Botox. Botox is fantastic for fine lines and wrinkles, you guys. If you think like, oh, at 55 years old, that woman doesn't have any Botox, yeah. There's been Botox going on since I was about 35. So for the last 20 years, I've done Botox on my crow's feet. Thank you so much. That's a great compliment, beautiful skin. I've done Botox on my crow's feet for 30 years. 30 years? 20 years, sorry, my math. For 20 years, that's a long time to have this paralyzed. Now, when you talk and you smile, it's still there, right? Our faces move. Nobody's gonna give you Botox here where you can't smile. That's gonna look very, very weird. But Botox out here, fantastic. Somebody asked earlier about filler in the tear trough. Now, if you remember when I first started this live, I talked about the 3 different places where we lose fat as we age. Our temples, our cheeks, our tear troughs. So if you have a hollowing here that is manifesting itself as sometimes a dark circle, sometimes it's manifesting itself as a bag, because if you lose fat, I'm gonna get real close to this camera, you guys. If you lose fat here, and this dips down, then you're gonna have a more pronounced eye bag out here. If you lose fat here, your anatomy that's underneath the skin is gonna be more apparent to shine through because you don't have the fat as the buffer. So it could manifest itself, it could present itself is a better way. It could present itself as dark circles. So if we're putting on creams to treat dark circles, but really the cause of that dark circle is a loss of fat in the tear trough, we're not really addressing the right conversation. We're not addressing the right concern. Does that make sense, everybody? Okay, so we went over the Dr. Penn in terms of fine lines and wrinkles. We went over the microcurrent device for fine lines and wrinkles, which I love. We also have these little kind of patches, which I need to get new ones because they've lost their stick. So we've talked about that for fine lines and wrinkles. There's also silicone patches that you can use. I don't use the silicone patches unless I'm traveling on an airplane, which is kind of interesting, but you should see me on an airplane, it's ridiculous. But if I'm traveling on an airplane and I'll put on a silicone patch, it really helps to draw moisture up from above, fills out those fine lines and wrinkles naturally because it's creating that barrier. But at night, I feel like I'm missing an opportunity for, you know, more of the chemical kind of ways to reduce fine lines and wrinkles. Okay, so just know that the silicone patches are an option. If, for example, you've got super sensitive eyes, you can't get anywhere near your eyes with retinoids, like let's just say you're super, super sensitive, a silicone patch might be your answer, right? So figure out what it is you're treating first. Figure out what you're treating. Super important. When you're talking about in-office procedures for the eyes, of course, you could do an upper bleph, you could do a lower bleph. I don't have those done to myself yet. I have nothing against them. It is a personal choice for whoever decides, like, listen, my eyelids are just, I can't see anymore, or I can't put on you know, eyeshadow anymore, and I love to put on makeup. Obviously, that's not me, but I love to put on makeup, and I can't do this anymore. It's just crepey. That is a personal decision for everybody. Just know that there are in-office procedures. Upper bleph is an upper eyelid where they cut around the lash line, or they will cut in the crease, and you'll have a little scar in the crease. It's done a lot for hooded eyes. And on the lower bleph, what they do is they cut on that lash line. And then they'll oftentimes, when they're doing a bleph like that, is they'll get a little fat transfer and put a little fat transfer in the tear trough. You have to be super, super careful when you are doing a filler in the tear trough. And I don't have that because I microneedle, because I'm super obsessive about microneedling and all the other stuff that I'm doing, that my skin has not, I still have thickness here in my skin around my eyes. When that thinness goes, when that skin starts really thinning out, you can see the anatomy underneath there, and a lot of people will lose the fat right there, and you'll see that anatomy, which will manifest itself in different ways. So not only could you do an upper and a low or a lower bleph in an office, which is like $5,000, you could do a tiny, tiny, tiny drop of a filler in that tear trough. And when I say a drop, I mean, if you're gonna go that route, just know filler does not go away. We think it does, people tell you it does, it really doesn't. It might move, it could decrease in size. There's lots of different things that can happen, but when you're testing something like this out in the office of a very skilled professional who does this, don't have them just go for it with both of your eyes. Do a drop. Ask for a sample. Ask for a sample size, which they have. They might not want to give them to you, but trust me, they have them. A sample size amount of a filler in one of your tear troughs, and then stand back. Wait for a bit. Look, you can always make another appointment, go back in, right? But look and see first, because sometimes when people do this, it migrates and you end up with a bigger eye bag. So yes, it could help. It could also make it worse. The good thing about filler, the one good thing about filler is you can get it injected with hyaluronidase and your body will absorb it. Somebody asked, how many times do I microneedle around my eyes? I microneedle around my eyes on my schedule, it's every 4 weeks, but I don't do it every 4 weeks because something comes up, or I want to add in the back of my arms, or I want to add in my hands. I probably microneedle my full face, including my eyes, about every 6 weeks. I design the calendar every 4 weeks because life happens. So every 4 weeks, you'll see I have microneedling of my face, and then the next week on Sunday, I'll microneedle my abdomen. The next week, I'll microneedle my neck and chest. And the following week, I'll microneedle my knees. So these are my concerns. You can insert your concerns where you have concerns. Maybe your stomach is like, you have no skin that's like loose on your stomach. You haven't had children yet, or you're just very blessed after having kids. Maybe that's not one of your weekly things. Add in the one that bothers you. Does it bother you around your elbows? Do your parents have very thin skin on the forearms that where every time they brush up against something, they're bleeding? You might want to consider microneedling your forearms because that will thicken up the skin. Somebody said, how do I get your protocol? This is the skincare protocol. This shows how you fit everything in, whether it's microneedling, radio frequency, microcurrent, red light therapy, chemical peels. How do you fit everything in? You DM me protocol. If you want the safety protocol and the step-by-step how to do it, the needle links, the speeds, the number of needles, all that, you DM me microneedling protocol. That one's completely free. This is also completely free. I'm just gonna ask you to sign up for the newsletter, you guys. And when you sign up for the newsletter, you just get these lives, all the clickable links, any product that I talked about, but you get these lives, a summary of them, and you can replay them as well. So it's really, I try to make it super convenient for you guys. Okay, moving on. We're still talking fine lines and wrinkles, and now I'm gonna talk about something that I have not yet done a whole experiment on the near laser. Okay. Somebody just said a skincare protocol, please. After this, DM me skincare protocol. Okay. Somebody says I have old stretchy marks on the inner arms with extra skin. Is it safe to microneedle those, please? Absolutely. Anytime wherever you have crepey skin, or you have like, oh, I don't like this, or I got gel, that means you can microneedle it. That's an opportunity. Whatever is bothering you is an opportunity. For me, I have little crepey skin above my belly button because I did grow 3 human beings in here. And so I've got a little bit of that. I usually do it here, the top of my knees to mid thighs, neck, chest, but if you want that schedule, you just DM me protocol, just direct message me protocol. And if you want the microneedling safety thing, you DM me microneedling. Okay, we're going on. I'm going to be using this tomorrow, you guys, on the live. I want to be very clear about something. You can do too much of these at-home devices. So just because you see something does not mean it's right for you. And it does not mean that it's safe in terms of the health of your skin to just start using it whenever. If you read the instructions on this says you use it every day. Every day you're supposed to use that. You cannot use this and follow this. Because if you have microneedled the shit out of your skin, which I normally do every 6 weeks, and then we've got radio frequency here too. So radio frequency, you can do too much of it. Microneedling, you can do too much of it. So if your skin is healing and you're going back over it with a laser, you could really damage the integrity of your skin. And I don't mean like you can damage it like you'll get a burn. I don't mean that. I mean you'll be causing more harm than good. You'll be really messing up the collagen production. Does that make sense? You don't want to start doing something that's going to create collagen. This is going to create collagen and elastin in the skin. And while that's being created, I'm going to go and screw something else up and microneedle. It's overload. It's just overload, you guys. So you have to be very careful. I'm going to talk more about this laser tomorrow on my Instagram live where I normally do demos, and those demos get posted to my subscription club. I'm going to talk about this laser. I'm not going to do it around my eyes because I just microneedled on Sunday, my full face. This is 7 days post microneedling. I've got a little dry spot over here, but this is no makeup. 7 days post microneedling. It's gonna get better, you guys. Wait till about 2 weeks and my skin's like, great. But what I don't wanna do is while this is still healing, this takes 30 days to heal. You won't see it because a lot of it is happening underneath the epidermis. It's happening in the dermis layers, the layers of the dermis. It's not happening, on the surface necessarily. You could get a little peely around the eyes when I'm doing it around the eyes. But what I don't want to do is like come back over the top of it while I'm trying to heal and mess up my collagen again. You got to be very careful with these. I'm going to talk about that tomorrow. But if you're somebody who you're like, there's no way, Darnell, I'm going to be putting this needles by my eyeball, even though you stay on the occipital bone. But if you know there's no way I'm going to be doing this, this could be your new best friend. I'm just saying. There's a lot of research on this. It takes 5 minutes. You're literally ding, ding, ding. There's like 2 like little sound things. They say to do like 4 layers of this. I'm going to get into it. But when you look at the before and afters, it's a commitment because it's every day. Now you can do it very, very quickly. This is called the Nira laser. Comes in 2 different heads. I do have a discount code for this, but I'm going to be testing this out tomorrow. I'm going to do a 90-day test on one of my hands. Why am I doing it on one of my hands? Because the hands have the same type of fragile, thin skin as the eyes. And I don't really want to test it out on my neck because that would be another place. I'd rather test it out on one hand for 90 days and let's see if there's a difference, because I'm going to still microneedle this hand every 6 weeks. I'm going to do this every day, and I want to see what is the difference in that. If it's something that you know, like, hey, I have fine lines and wrinkles, but there's no way I'm going to do microneedling, this might be something you want to look into, right? Or you microneedle for 6 months, you wait for that 30 days for your whole skin to heal, and you've gone 30 days with no microneedling, and then you want to try this for 6 months. That's how you would incorporate something like this. Okay, you can do too much of a laser, you can do too much of radio frequency, you can do too much of microneedling. I want for all the women out there, hey Lizzie, for all the women out there who have ever curled your hair to the point of, it's like, if you're with a hairdresser or whatever, you're like, hey listen, you put one more curl in this hair, it's gonna start fighting you. It's gonna start like, it's just not gonna do it. It's not gonna do what you're asking it to do. If you are doing too much, I don't have my radio frequency device here, but if you're doing too much, that's over there, of microneedling mixed with laser, mixed with radio frequency, equate that with that hair that just won't hold a curl anymore. That's if you can get that in your head, you won't just like pick up anything. Hey, let's try this. Hey, let's try this. You have to understand what's happening to your skin that might not be visible on the surface, but what's happening underneath. And if we're gonna do this long term, I'm 55, I plan on doing this for a long time, you guys. If you're gonna do this for a long time, like me, you wanna know what you're doing, you wanna schedule so that you know, okay, I'm not taking 3 steps forward and 5 steps back, right? I don't have that hair that's not gonna curl. I don't have that collagen that's just not going to, produce that structure because it's overworked. It's overworked. So there is a method to the madness. If you want this, you just DM me protocol. Okay, so I am gonna be talking about the Nira laser. I personally would not do it at the same time, not personally, don't do it at the same time as you're healing from a microneedling device. Don't do it. Don't do it. It's gonna take 30 days. Let this heal, then you can start testing this out, okay? Let it heal. Don't take 5 steps backwards. Okay, so that's the Nira laser, which we're not gonna use until we do a little bit more research and we make sure that we're clear on how we're layering and overlapping these kind of treatments at home. Okay. Sorry, you guys. Okay, so now we already went over the upper and lower bleph, which I don't have. Not against it, you guys. It's a personal choice for everybody. Our skin is associated with our self-esteem. If somebody doesn't like something, they've had these nice perky eyebrows or nose, skin loose anywhere on their whole face, and they all of a sudden it doesn't make them feel good what they're seeing in the mirror. First of all, try all this stuff at home like I am. Be consistent about it. But whatever you decide to choose, however you decide to choose to age is on you. I just literally give you guys, hey, here's what's available. Here's what's available for you guys, which is another thing if you want to talk about fibroblasting, okay? Because fibroblasting, I did a video on that. I've only done it one time, and you have to be consistent, but the before and afters when I did on my upper eyelid were pretty dramatic. I only did it one time so you guys can see what it is. I could try to explain the pain involved in that, but that's the one where you've got the little dots everywhere, and is very painful. It's probably one of the most painful things I've done in office. I just wanted to see, what does one treatment do? It was dramatic, but it's super expensive, and I'd rather do all of my stuff that I love at home. I feel like consistently, if you can consistently follow a protocol at home and you give your skin the respect it deserves of no more than 30 minutes a day, just like you would meditate, just like you would work out, if you're giving your skin that respect and you're doing it in a way that you are educated in how you're overlapping these devices, I have found personally that I get a lot better result when I'm doing it consistently and at home and not as deep of a treatment as I would in office, because it's hard to maintain those kind of in-office treatments, right? It is. Okay, so let me see. I think I missed a couple questions, and then I'm gonna move on, you guys, to eye bags. Eye bags, if you got eye bags, it's coming up. Let me just see if I missed anything really quickly. There was something about my microneedling at doc's office every 6 weeks, the same. Do you do it at home for saving it? It scared me to messed up. Oh, it scared me to messed up. I'm sorry. You guys, I have astigmatism in my eyes, so sometimes it's hard for me to read off of this. Okay, so yes and no. If you did microneedling at home, if you went in and said, hey, listen, I want you to microneedle around my eyes for my crow's feet, fine lines and wrinkles, skin elasticity, all that. They're gonna go deeper than what I would do at home. And they're not gonna go as consistently. So if you did, I guarantee you, if you told a doctor, hey, I wanna come in every month, every 4 weeks and microneedle my whole face, they're probably gonna be at the same levels that I'm doing it at home, right? They're not gonna do a 2.0 millimeter if you're coming in next month. That's not a way that you're gonna heal, that's gonna be beneficial to your skin, and you could be taking those 5 steps backwards, okay? So yes and no, it is the same type of treatment when somebody's microneedling in the office or you're microneedling at home, but if you're doing it consistently at home, it's just a lot easier for that upkeep. But if you're doing it consistently in the office, they are going to adjust the needle depths to be more like what I'm doing at home. And how do I know that? Because I've spoken with them. I know. I know. I have somebody who works for a spa that their big thing is that they have somebody come in every 4 weeks to microneedle. They charge a certain amount, but they do it very quickly, and they're at a 0.5 millimeter for the entire face, not as deep on the neck and not as deep around the eyes. They're more at a 0.25. Guess what I do at home? 0.25, and if I'm doing this, I know about if I need to get a deeper treatment, which is not every 4 weeks, I'll usually do like a deep treatment, like I want to say, where I'm doing the 1.5 and a 1.5 here. Every few months, normally it's like just a 0.5 to a 1.0 and then very light around the eyes. Okay, I missed something else. I did on my scar, it made a difference. You guys, I'm gonna start testing it. I wanted to get through my daughter's wedding, but what I'm gonna start doing, in fact, I might do this tomorrow live as well. I'm gonna test out the near laser on one hand. I'm gonna do this for 90 days on one hand. I'm kind of excited about it, to be honest with you. And then I'm gonna do one arm. I've got these farm girl arms. See if you can see. I've got this scar, fell off a barbed wire fence. When you fall off a barbed wire fence when you're little and you grew up on a farm, you're looking at multiple scars. And I've found that through menopause, my scars, they used to blend in and now all of a sudden they're white. So what I'm gonna do is I'm gonna do a test on all of these scars because they're the same on both arms, but this one has just the one big slice in it. I'm gonna test the Dr. Pen because I've had a lot of questions about scars that are flat and white. This is perfect for this. It's perfect for stretch marks as well, and it's perfect for all of these fine lines around the eye. But I'm gonna test this on there. Okay, I have to get back to eye bags. We're going to eye bags. So remember, if you're looking at creams around the eyes and your concern is fine lines and wrinkles, you're looking at a retinoid, for a cream. You're looking at something like a 3rd generation adapalene. This is not made for the eyes, but I use this for the eyes all the time, and I'm loving it. And then this is my all-time favorite, Zeo Skin Health. This is super expensive. Okay, we're going to eye bags now. And I'm gonna work on these. When you're dealing with eye bags, there's a couple different ways that you can address them, but mostly you wanna lymphatic drain. You want to lymphatic drain. You want to lymphatically drain the whole area. And so you're looking to push the fluid out towards your channels on the top of your ears that drain down. So whenever I'm dealing with eye bags, this is the Nurse Jamie Uplift. It's just one of those massage rollers. You don't necessarily have to use this. Any of these kind of devices that have a little sonic vibration can also lymphatically drain. So can dry brushing. So you're just literally pushing that fluid out towards those channels. So if you look at my face right now I know this one is pink, but let's just look at one eye compared to the other. You see this little eye bag here is a little bit more prominent on that side. It's because I just moved this fluid out. So I'm moving this fluid out a little bit. You can roll it out. You can dry brush it out. You can sonic vibration it out. You can also microcurrent it out. So if you used a conductive gel, I don't have conductive gel on my face, but doing motions like this, guess what that's doing? It's pushing out that fluid from that eye bag, right? It's pushing out the fluid from that eye bag. So even just looking at my face right now, I've worked on this side just very, very, very briefly, right? With a roller. I worked on it a little bit with a dry brush and just moving that fluid out. I worked on it a tiny bit with one of these sonic things. And just the motion, this isn't even plugged in, this isn't turned on, but just the motion of pushing the fluid out. Look at the difference between this eye and this eye. You see this eye bag? I'm lit exactly perfectly, you guys, on all sides. I'm at a vanity. You see how this still has a little bit of fluid? That's the difference between treating the eye bag and not. Now, if I were to go and put on a type of, oh my God, I can't even think, type of eye cream. Hello, this is about the eyes. If I were to put on a type of eye cream like a hyaluronic acid or something that was very, very moisturizing, guess what's gonna happen? The eye bag's gonna get worse. If you're using an eye cream at night that is very hydrating, but you suffer from eye bags, you're making your eye bags worse. So when you wanna use a cream and eye bags are your problem, look for something with caffeine in it. Look for something with caffeine. So let's see, I'm just gonna do this other eye over here. This is by The Ordinary. This is the caffeine solution 5%. It's on my Amazon store, you guys. Almost everything that I talk about is on my Amazon store just because I don't have time to really chase a lot of affiliate marketing stuff. If I can save you guys a little bit of money, I will. But it's a lot of work to do that. So I'm just putting on a little bit of caffeine solution on this one eye. And then you could even roll it out. So you would just roll out that lymphatic, that fluid. And that's why you're always aiming towards, the top of your ears because you've got channels here. But you can see, now see, I'm only doing this roller. Let's see if I can catch him up. Okay. So nothing, you guys, nothing really ages you like eye bags, right? Do you ever get that comment like, you look tired? Don't ever tell somebody that they look tired. Thank you, beautiful. I have to go to work. Oh, you guys, I'm going to post this afterwards on my main feed. So you can always see my Saturday lives on my main feed. It's my Sunday lives that get posted for my subscription club. But on my main feed, this will go. So you can always, come back and like catch up or go where you left off. Okay. So, there's only so much cucumbers and ice packs and all of that stuff can do. I'm telling you, it's the physical manipulation of the fluid to bring it out to the sides. Look, I love this one because it's actually got this curve to bring that out to the side. And you can kind of feel, you don't have to go really hard, but you can kind of feel the fluid kind of drain down a little bit. need to put a little bit of more eye cream on. Just when you're dry brushing, you want your skin dry. When you're doing any sort of physical manipulation like this, it's usually better with a little bit of cream. So I can push this out. Right? That's how you would get rid of the eye bag. Okay. Yes, in terms of eye bags, if you have lost you've lost a little bit of fat here, it could potentially make an eye bag worse. So that is when you could go and ask a plastic surgeon or a dermatologist, hey, have I lost fat in my tear trough? Is that why the eye bag is making it worse? And then let's figure out how to address that. I'm telling you, if you're doing this consistently, you're building collagen and elastin, it does build that area up, okay? But there's a lot of genetic components when it comes to eye bags. And so, yes, you could have it surgically removed. Again, I'm not a proponent for that, haven't done that, but I do know that that is an option out there. It's something that if it bothers you, I want you guys to at least know that that is something that's out there. Okay. So that's basically it. The eye creams, you're looking for caffeine in the eye creams, which will help with that, you know, the puffiness. You're looking for the physical manipulation of lymphatic drainage to get the eye bags reduced. And now let's move on to dark circles, because, you know, between eye bags and dark circles, that's what makes us look so tired. Bye, lovey. That's what makes us look tired as we age. Somebody asked, can I speak about jowls, please? Today is all about the eyes, but I'm going to be back here tomorrow, and I will answer all questions tomorrow. If I don't get to your questions today, I'm here tomorrow, and that's where I usually will demo something. So I'm going to demo the Near laser on my hand, and I'm also going to work on the scars on one of my arms. And that's what I'm going to be doing tomorrow. And I will have plenty of time then, because I'm not teaching, I'm just showing, for you guys to ask any questions about jowls. There's a lot that you can do with jowls. Mostly radio frequency at home is what I love, and a little bit of microcurrent. That's really what I've found. How did you get rid of the deep crease in your elbows? Again, let's talk about it tomorrow, but deep crease in your elbows, you need a crease, you guys. You got to move. Look, I still have a crease. If you didn't have this, how would your skin move? Honestly, how would you be able to bend? You wouldn't be able to bend your elbow. You need that. So some of these things are like, you know, things have just been so photoshopped in social media that we think like, oh, we're not supposed to have a wrinkle back there. You are. You need it to actually move, right? Which is why I do all of these lives like with no makeup. I want you guys to see, this is what 55 looks like. This is what it looks like. Now it's 55 that's very, you know, regimented and educated, but it's a possibility. It's a possibility, right? You just need to give that devotion to the same kind of devotion you give to your heart and your lungs and your muscles, all of that stuff, your bones as you age. Your skin's your largest organ. Give it some love. It doesn't take long. People think I do this all day. I don't. It's less than 30 minutes a day I spend doing something to my skin. Less than 30 minutes a day. That's not a lot. How much time have you wasted binge watching something on Netflix? 30 minutes a day for your skin. And it's tied to your self-esteem. So it's way more than just, you know, a lack of wrinkles. It's way more. It's taking control of your skin and the aging. Some things we can control, some things we can't. Okay, so dark circles. These are very much misdiagnosed. A lot of people, my one-on-one clients, one of the big concerns is like the dark circles. I can't get rid of the dark circles. And then I have them send me a picture of their eye up close, and it's very misdiagnosed. Again, because lymphatic drainage and because of loss of the fat. Loss of the fat or thinning of the skin. These are some of the causes of dark circles. And the only way we know how to treat something is if we get to the root cause of it. What is causing your dark circle? Is it a thinning of the skin? If it's a thinning of the skin, thickening the skin, this thickens the skin, helps with that. Thickening the skin helps with that. Thinning of the skin, you can see the anatomy underneath. So as we age and we lose that collagen, we lose that elastin, the skin becomes thin without the collagen structure there, or the depletion of the collagen there. It becomes thin and you start seeing the anatomy. So what you could perceive as a dark circle of the epidermis, the outer skin, is not. It's the anatomy shining through that very thin outer skin that is manifesting itself or presenting itself as a dark circle. So the last thing you'd want to do in that case is to add like a hydroquinone or something like that will brighten up the skin and get rid of the darkness. If you added a hydroquinone, you're going to thin the skin more. You're doing something that is not going to help with that situation. Because last I checked, hydroquinone did not thicken the skin. And listen, I'm not a dermatologist, you guys. If I'm wrong, somebody call me out, DM me and say, hey, listen, have you looked at this study? Have you looked at this study? Send me stuff. That's where my jam is. I like to does it really work? Does it work? What are we trying to treat here? So when you're looking at dark circles underneath, really, I want you guys to think about what is causing that. Is it a shadow? Sometimes you can get like a big brow bone. And when we lose fat in our cheeks, you guys listen to this one. This is gonna shock you. Because I had a client like this. This is how I know this. I had a client like this and it took me a while to figure it out. She had lost fat in her cheeks. So cheeks go down, right? She had a big brow bone. So where her brow bone and her cheek used to be about the same. Her cheek then went down, exposing this thing, her eye bag, and the shadow. Let me see if I can do this. Okay, look. If you've got a light overhead, you see how the shadow, doesn't it look like, oh, she might suffer from dark circles under her eyes? I don't. So sometimes even a picture of a shadow, now it looks like I do here because I didn't roll that bag out. But that's another way for you guys to be able to see what I'm talking about. If you've got a bag, sometimes it will manifest itself as a dark shadow. Sometimes if you've got very thin skin, you'll see the anatomy underneath. Sometimes if you've got a pronounced brow bone and all of a sudden your cheeks have now decreased with age, the shadow from the brow bone might be casting a shadow that makes it look like dark skin. We got to get to the bottom of it. But there is a genetic component. So there are people out there that regardless of this, in bright light, no shadow, no eye bag, they've been microneedling, so there's no thinning of the skin, they still have a dark cast to their skin. There is a genetic component of that, but let's make sure we're treating that genetic component and not the other stuff, because you're missing an opportunity to do something that really works. If you're using like a lightener or a brightener, the ones that I use over the counter are vitamin C. I like Timeless because it's cheap. Again, it's on my Amazon store. Or you can use like a niacinamide. Both of these brighten and kind of lighten the skin. But if you're talking about something that is genetic component and it's a true darkening under the skin, then things like a hydroquinone under a doctor's care, staying on it for no more than 4 months, because again, you will take 5 steps backwards. In fact, if you overuse hydroquinone, you could permanently damage your skin. Your skin turns black, like black. So imagine if you've seen like the football players who got the black marks under your skin, hydroquinone when used excessively without a doctor's care can have devastating effects that cannot be reversed. So before you start reaching for a hydroquinone, make sure that you are under a doctor's care, that you're on it for no more than 4 weeks at a time, and that it's actually the skin discoloration that you're treating. You're not treating a shadow, you're not treating an eye bag casting a shadow, you're not treating a loss of fat in the tear troughs that is then causing, a bit of a shadow. Make sure that you're treating what you think you're treating before taking any steps forward, because I'm telling you, you're gonna waste time, you're gonna waste money, you're gonna take a bunch of steps backwards. So know what you're treating. So if you guys learned nothing else from today, know if you're treating, what are your concerns? Go look in the mirror. What are your real concerns? Are they fine lines and wrinkles? If they are, you're looking for retinoids. You're looking for things like microneedling. You're looking for chemical peels. You're looking for things that have retinoids in them. That's fine lines and wrinkles. If you're treating things like eye bags, you want to look for creams that have caffeine in them. You want to lymphatically drain by pushing out the fluid, right? Push the fluid out, whether that's from dry brushing, whether that's from these rolling devices, whether it's sonic vibration, whatever it is, that's what you're doing, is you're pushing out that lymphatic drainage. Now, if you're talking about the darkening of the skin, make sure you know what you're treating, right? It's not presenting itself as something different. Okay, so I talked about shadowing, thin skin, allergic reactions. Okay, I had a client that came to me for dark circles under her eyes. She said, I cannot stand this. I just have all these dark circles. I looked at her skincare, and she was using something that was causing so much inflammation in her skin that she had like a reddish kind of raccoon eyes. I took her off all of her skincare for 2 weeks. Nothing. I don't want you to do anything but wash your face with like a CeraVe or a Physoderm with a pH balance. Do nothing else. In 2 weeks, less than that, I had her take a picture every day. It just got better and better and better. So her skincare product was causing a darkening of the skin underneath that was actually irritation, but it didn't irritate her the way that you would think. It just made the skin red. Understand what you're treating first, okay? And then if you are actually treating the dark circles, that's what your real root cause is a genetic thing, then you can be under the doctor's care with hydroquinone. You can also look for eye creams that have vitamin C in them. You can look for eye creams or use creams like serums like this that are niacinamide. All of that kind of, brightens up the area. But if you are really treating dark circles, the number one thing that's gonna make them worse is the sun. So don't do all these treatments and then go out in the sun. You need a hat, you need a factor of 30 plus. You need not only a sunscreen that has 30 plus, but a tinted sunscreen is always best if you're having discoloration in the skin, because it has that added protection of the ion oxide. So it's not just a zinc oxide when you're doing a tinted sunscreen. This one's my favorite. I love this one because it's like a super serum. So it has niacinamide already in it. So what I was just talking about brightening the under eye, when you're looking at something like this is by Ilia. It's very liquidy. Oh, I can't believe I actually aimed and got that in there. It's very liquidy, but it's a broad spectrum 40 with zinc oxide, but it has an ion oxide as well because of the tint. So it's a super serum tint. So hyaluronic acid, squalene, niacinamide, which was brightening the skin. So if you are somebody that has melasma or discoloration or dark circles, you guys, you have to stay out of the sun. You have to stay out of the sun. Okay. I think that's it. Do I have anything else? Do you guys have any questions? Let me see if I can scroll back up. Again, I'm going to be here tomorrow, you guys. I'm going to be here tomorrow, same time, 11 a.m., and I can answer any questions that you have there. Today was just about eyes, so I hope that you guys got something out of this, right? Understand what you're treating first before you just dive in, and make sure that you're not causing more harm than good. You don't want to take the 5 steps backwards when you think you're doing something good, okay? So for those of you just joined, I'm gonna post this right afterwards in my main feed, so you'll get the full 1 hour live. Any questions, let me know. I am working on a younger looking eye protocol. I should have it by Monday. So if you want like a recap of all of this stuff, you can DM me younger eyes, and just give me some time because it's going to be a little bit before I can get that to you, but I am working on it this weekend, and I will have that so that you guys can try to diagnose for yourself, right? What will the Naira do to under eye kids. I would not do this on a child. Don't do this to kids at all. No, 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 no. And I'm going to talk about this tomorrow because I'm going to demo my hand. Okay. You're so welcome. I'm so glad that you guys like this. Okay. So if you want, like my top if you want like my top things, like I have like a whole kind of list where I can give you my top anti-aging, not anti-aging, my top healthy skin, at-home devices. Just DM me eyes and I'll get you the link to like the Neura laser, which be careful if you're doing this. If you're doing this, don't buy this, okay? But it will give you at least something for the microcurrent. It'll give you like a link for the Dr. Pen. And you can always find everything on Amazon anyways. Okay, you guys, it's been a great Saturday with you guys, and I will see you tomorrow at 11 for a lot of demos. Okay, have a great day.